Biliary atresia is a rare but serious liver condition that primarily affects infants. It occurs when the bile ducts, which are essential for transporting bile from the liver to the gallbladder and small intestine, become blocked or absent. This blockage prevents bile, a fluid that helps digest fats and remove toxins, from exiting the liver. Over time, the accumulation of bile within the liver leads to inflammation, scarring, and eventually liver damage. Causes and risk factors. The exact cause of biliary atresia remains unclear, but researchers suggest that it may be linked to a combination of genetic, environmental, and immune factors. Some potential causes include congenital abnormalities. In some cases, infants are born with malformed or missing bile ducts. Viral infections. Certain viral infections during pregnancy or shortly after birth may trigger inflammation and scarring of bile ducts. Autoimmune disorders. The immune system may mistakenly attack bile ducts, causing damage. Genetic mutations. While biliary atresia is not typically inherited, genetic mutations may play a role in rare cases. There are no known specific risk factors, but it is slightly more common in females and certain ethnic groups, such as Asian and African American populations. Types of biliary atresia. Biliary atresia is classified into two main types based on when the condition develops. Fetal/embryonic biliary atresia. This type occurs during fetal development and is often associated with other congenital abnormalities, such as heart defects or spleen malformations. Perinatal/acquired biliary atresia. This type develops after birth, typically within the first few weeks of life. It is the more common form. Symptoms. Symptoms of biliary atresia usually appear within the first 2 to 8 weeks of an infant's life. Common signs include jaundice, a yellowing of the skin and eyes due to the buildup of bilirubin, a byproduct of red blood cell breakdown that cannot be effectively excreted. Dark urine. Elevated bilirubin levels result in urine that appears unusually dark. Pale or clay-colored stools. Lack of bile in the digestive system causes stools to lose their typical brown color. Enlarged liver. Hepatomegaly. The liver may become swollen due to bile accumulation. Poor growth and weight gain. Infants may fail to thrive due to impaired digestion and nutrient absorption. If untreated, biliary atresia can lead to severe complications such as cirrhosis, permanent liver scarring, portal hypertension, increased blood pressure in the liver's veins, and liver failure. Diagnosis. Early diagnosis is critical for improving outcomes in biliary atresia. Diagnostic steps typically include physical examination. A healthcare provider may identify signs such as jaundice or an enlarged liver. Blood tests. These measure bilirubin levels, liver enzymes, and other markers of liver function. Imaging studies. Ultrasound or specialized scans like hepatobiliary scintigraphy can visualize bile ducts and detect abnormalities. Liver biopsy. A small sample of liver tissue is examined under a microscope to confirm the diagnosis and assess liver damage. Intraoperative cholangiography. In some cases, a surgical procedure is performed to directly visualize the bile ducts. Treatment options. Biliary atresia requires prompt medical intervention, as there are no medications that can reverse the condition. The primary treatments include Kasai procedure, hepatoportoenterostomy. This surgical procedure is the first-line treatment for biliary atresia. During the procedure, the damaged bile ducts are removed, and a segment of the small intestine is connected directly to the liver. This allows bile to drain into the digestive system. While the Kasai procedure can restore bile flow in some cases, it does not cure the disease. It is most effective when performed within the first 2 months of life. Liver transplantation. If the Kasai procedure is unsuccessful or if liver damage progresses, a liver transplant may be necessary. This is a definitive treatment that replaces the damaged liver with a healthy donor liver. Advances in surgical techniques and post-transplant care have significantly improved the outcomes of liver transplants in infants with biliary atresia. Prognosis. The prognosis for biliary atresia depends on factors such as the timing of diagnosis, the success of the Kasai procedure, and the extent of liver damage. With early intervention, many children can achieve improved bile flow and delayed progression of liver disease. However, many patients eventually require a liver transplant. Long-term outcomes for liver transplant recipients are generally positive, with most children leading normal, healthy lives. Advances in medical care and immunosuppressive therapies have improved survival rates and quality of life. Coping and support. Parents of children with biliary atresia face unique challenges, including navigating complex medical decisions and managing the emotional toll of the disease. Support resources include specialized care teams. Pediatric hepatologists, surgeons, and nutritionists provide comprehensive care. Support groups, connecting with other families affected by biliary atresia can offer emotional support and practical advice. Educational resources, learning about the disease empowers families to make informed decisions about their child's care. Conclusion. Biliary atresia is a serious but manageable condition with timely diagnosis and treatment. While it poses significant challenges, medical advancements, including the Kasai procedure and liver transplantation, have greatly improved outcomes. Awareness, early intervention, and supportive care remain crucial for ensuring the best possible quality of life for affected children and their families.